I'm Dr. Reena Gupta at the Center for Vocal Health located here in Los Angeles, California. I wanted to talk to you today about a complete vocal health exam for vocal athletes. The reason I think this is so important is that of the 4 phases of this exam, so often parts are sort of omitted, and I really think that that is a disservice to vocal athletes. So my thought is, if I teach you what you need to know, you are better able to advocate for yourself when you go to the doctor. Part 1 is the history taking. This is something that we are trained to do in medical school kind of quickly. The problem is that for a vocal athlete, you can't skip this part. It is the easiest part to skip because we're always tempted just to jump to the scope, but when you do that, you miss some really important information. A history is not just of this moment and what brought you into the office today. A lot of the times with athletics, you need to understand the history of that sport for that person. There are going to be old injuries and old issues that matter while you're in that exam room for that day because they impact your vocal health. History taking is a huge part of the exam and should include other relevant medical issues, including medications that you're taking, allergies that you have, non-medical and medical treatments that you're engaged in. All of this stuff really helps us to understand better who you are as a patient. Cannot be skipped. Second part that I really focus on, again, and I think it's missed, is a voice exam. Not the scope, which is really tempting to skip to, but listening to that performer. I'll have my patients bring in sound samples of them before they were struggling with whatever issue brought them in. Sound samples of the issue itself. I'll ask them to do vocal tasks while they're in the office. It's why I have a keyboard here. Sometimes if it's a voice actor or a stage actor, they will show me video or audio of their issue. This is extremely helpful in understanding what's going on because describing voice is really inaccurate. What is hoarseness? What is raspiness? A sound is worth 1,000 words, and so I really like to listen to my patients. Their words, their duration of being able to speak before they need another breath, the quality of their voice, and their voice as it's being tasked the way they need to do it professionally. The third part is the general ENT exam. All of us who are laryngologists were first trained as general ENTs before we did the extra training in laryngology. This means that we are fully capable of and should examine the ears, the nose, the mouth, and the neck. This gives us tremendous clues about the impact of reflux, allergies, and a lot of other medical conditions on, you guessed it, the voice. The vocal cords do not live on an island. They live as part of this whole system, so it's on us to identify what other medical issues might be affecting your vocal health. Finally, we get to do the scope. It is extremely important. I'm not downplaying it, but it should be the last thing. And generally, in my experience, by the time I get to the scope, I kind of already know what to expect. I'll use a combination of flexible laryngoscopy, which is a scope in the nose, that I will use when I'm trying to assess the muscular condition of the voice, and rigid stroboscopy. That's a scope that goes in the mouth. We use a strobe light that slows down the vibration of the vocal folds so that we can really visualize it and understand microscopic injury. The risk that you run into in most offices is people rushing to the scope, and that's what I call treating the picture. When you rush to treat the picture, you often run the risk of over or under treating because you've missed really important clues about the patient's issues and their history. Maybe that blood vessel that you're seeing, or maybe that little bump has been there for their entire career. Just because I find it on that scope, it doesn't mean it needs surgery. When you tie together all 4 parts of that vocal health exam, you're more likely to get accurate and successful treatment. Subscribe for more tips on how to take care of your voice.